Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with small intestine, large intestine, liver, gallbladder, and pancreas ailments, starting with the letter P1, first part. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I will address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small, large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and the metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, postnatal problems, and then special problems of infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude toward life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let's continue with learning how homeopathic treatments can help with small intestine, large intestine, liver, gallbladder, and pancreas ailments, starting with the letter P, Part 1. From the stomach, food enters the duodenum and small intestine. The food is then squeezed into the cecum through a small valve, then passes into the ascending, transverse, and descending parts of the colon, our large intestine, and finally to the rectum and anus. The total distance between the stomach and the anus is about 26 feet. The whole journey takes 18 to 30 hours from the time the food leaves the stomach. The liver and pancreas empty their digestive secretions into the duodenum through a common duct, the bile duct. Bile produced by the liver emulsifies fats, and enzymes produced by the pancreas get to work on proteins, starch, fats, and sugars. The liver does many things besides aiding digestion. It stores glycogen, a compact form of glucose, and also vitamins A, B, D, E, and K. It removes toxins, for example, alcohol, from circulation. It manufactures blood proteins and blood clotting agents. It synthesizes cholesterol, a vital component of all cell membranes and the precursor of many hormones. It converts saturated fats to unsaturated fats when the body is obliged to use fat rather than glucose for energy. It breaks down and recycles the iron-rich, oxygen-carrying pigment hemoglobin. It dismantles excess amino acids and excretes the nitrogen-containing components into the blood as urea. Urea is one of the constituents of urine. It also produces a great amount of heat because of all the chemical reactions going on inside. The pancreas is a gland about 6 inches long, lying beneath and behind the stomach. It produces large amounts of sodium bicarbonate as well as digestive enzymes. Sodium bicarbonate is alkaline and therefore neutralizes the hydrochloric acid produced by the stomach. It also produces two important hormones, insulin and glucagon, which control sugar uptake by every cell in the body. The gallbladder has no secretory function. It merely stores and concentrates bile sent to it by the liver and empties it into the duodenum in response to a hormone that is secreted whenever fatty foods leave the stomach. The small intestine has two functions: to complete the food breakdown process and to absorb nutrients into the bloodstream. Although it is only 21 feet long, it has a total absorptive area of 200 square feet. This is because its inner walls are lined with millions of finger-like projections called villi, each containing blood capillaries and tiny tributaries of the lymphatic system called lacteals. Amino acids, glucose, and small fat droplets, vitamins, and minerals pass into the capillaries, and larger fat droplets into the lacteals. When whatever remains unabsorbed by the small intestine, about 5% of fats, 10% of amino acids, fiber, some vitamins, bacteria, intestinal secretions, salt, water, all pass into the colon, where it is gradually compacted into a semi-solid feces. The bacterial population of the colon manufacture vitamin K, B12, B1, and B5, and certain amino acids. These are absorbed by the walls of the colon together with salts, water, and other valuable substances. Transit time through the colon depends mainly on the amount of roughage in the diet. Too little roughage causes constipation and related ailments, such as hemorrhoids and diverticulitis. Pancreatitis is an acute or chronic inflammation of the pancreas, often associated with gallstones. It occurs when powerful enzymes secreted by the pancreas, destined for the gut, leak into the pancreatic tissue instead. Acute pancreatitis can be precipitated by blockage of the pancreatic duct by a gallstone, parathyroid problems, excessive amounts of food or alcohol, abdominal injury, or in rare cases, mumps. The symptoms come on 12 to 24 hours after excessive eating or drinking, with agonizing pain in the upper abdomen, radiating to the back and chest, and vomiting. The person may even go into shock. The appropriate action is to call 911 and give Aconite 30C every 15 minutes for up to 6 doses until help arrives. In the hospital, painkillers will be given and an intravenous drip to enable the digestive system to rest. Surgery to remove the gallbladder may also be necessary. Chronic pancreatitis develops slowly, sometimes as a sequel to acute pancreatitis. It causes a dull upper abdomen pain, usually relieved by bending forward. Most sufferers are heavy drinkers or have gallstones. As enzymes and hormone manufacturing functions of the pancreas deteriorate, chronic indigestion, mild jaundice, or diabetes may set in. Orthodox treatment is to prescribe painkillers and replacement enzymes, or in extreme cases to remove the damaged part of the pancreas. For chronic pancreatitis, constitutional homeopathic treatment is recommended, although the following remedies may be taken while expert help is being sought. Specific remedies to be taken every half hour for up to 10 doses. If all food is being vomited up and everything appears larger than usual with a dry throat and difficult swallowing, use Atropine, 6C. If there is an empty, gnawing feeling in the upper abdomen that is made worse by cold and by food and drink, especially milk, and the person is thirsty and the stomach is full of wind, with painful burning sensation in the navel region, use Kali Iod, 6C. For stabbing pains in the upper abdomen and the person feels chilly and the sweat smells offensive, with signs of jaundice, use Mercurius, 6C. For cutting pains in the upper abdomen and watery stools and a burning sensation in the bowels and rectum, use Iris, 6C. For cutting pains in the upper abdomen that intensify in warm, quiet surroundings, especially when lying on the right sides, use Iodum, 6C. For fiery, burning pains in the upper abdomen that get worse between midnight and 2 a.m., and the person feels chilly and restless, use Arsenicum iod, 6C. For jaundice with large yellow patches on the abdomen and an empty sensation in the stomach, with sharp cutting pains in the upper abdomen, and a craving for cold drinks, although these are vomited up as soon as they become warm in the stomach, use Phosphorus, 6C. Self-help. Give up alcohol altogether. Chances of recovery are minimal if the pancreas continues to be poisoned by alcohol. Peritonitis. Peritonitis is an inflammation of the membrane that lines the abdominal cavity and covers the abdominal organs. It is usually a complication of conditions such as perforated peptic ulcer, divicular disease or ruptured appendix, or pelvic inflammatory disease, but occasionally it can be a result of injury or abdominal surgery. The symptoms are severe abdominal pain, a rigid, distended abdomen, nausea and vomiting and fever. There is also a danger of dehydration from vomiting and ileus. The appropriate action is to call 911 even if the pain decreases. Specific remedies to be given every 5 minutes for up to 10 doses until help arrives. For sudden onset of severe abdominal pain and the person is chilly and fearful, use Aconite 30C. If the pain feels as if the intestine is being gripped by nails and the transverse colon above the navel is swollen and clearly outlined, use Belladonna 30C. For griping, cutting pains with great tenderness over the painful area and a great urge to pass stool, use Mercurius Corr, 6C. For cramping pains that are relieved by bending double or pressing on the abdomen, use Colocynth, 6C. For fever with sharp pain made worse by the slightest movement, use Bryonia, 30C. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.